This is Dr. Jean Gouda presenting the effect of short-term spinal cord stimulation on complete traumatic paraplegia to the annual meeting of the British Pain Society 2021. The history of management of spinal cord injury can be divided into three periods. The first period starts with Imhotep, the old Egyptian doctor, who accurately described complete cervical spinal cord injury in Edwin Smith's papyrus 4,500 years ago. At the end he said, "This I cannot treat." And this was the situation till the Second World War. We just leave them to die. Starting from the Second World War, we learned how to help them survive, but we could not cure their paralysis. Till 2011, when Susan Harkema from Louisville, Kentucky, reported spinal cord stimulation of the lumbosacral area to increase the central state of excitability of the spinal cord in her patient Rob Summers. After spinal cord stimulation, he could immediately stand, and later he could voluntarily move his big toe. Not only did he prove that human spinal cord is similar to mammalian spinal cord in having a central pattern generator with all the programs of standing, walking, and sphincter control inbuilt inside. They also proved that there is very rare, if any, complete spinal cord injury. There are always surviving spinal cord tracts that connect the brain to the spinal cord and allow patients with allegedly complete spinal cord injury to voluntarily move the lower extremity on spinal cord stimulation. Unfortunately, after this, several patients had spinal cord stimulator implanted to help their rehabilitation from complete spinal cord injury. Unfortunately, the expensive device and the variable, unpredictable pattern and extent of recovery limits the use of spinal cord stimulator in spinal cord injury. In my research, I put spinal cord stimulator trials in 20 patients with complete spinal cord injury as evidenced by electrophysiology. There was no selective bias. The only criteria was that the patient had complete spinal cord injury and intact T11-12 segments with complete spinal cord injury above. 3 of my patients regained voluntary motor movement in the lower extremity during the short period of stimulation. Another 5 regained sensation in the lower extremities, some of them with sphincters, control, or improvement of spasticity. I propose the feasibility of using spinal cord stimulator trial in predicting the response to spinal cord stimulation and selecting patients for permanent spinal cord stimulator implant, similar to the situation in pain. Thank you.